Good morning, everyone. On behalf of the Learner Support Cell of the Faculty of Health Sciences at Open University of Sri Lanka, it gives me immense pleasure to welcome you all to this special session on stress. Today, we are here to explore strategies that can help us resolve challenges of life with resilience and well-being. We are on to us an exceptional Dr. Ruwan Jayatunge, vast expertise and illustrious career in mental health undoubtedly inspire and guide us. Dr. Ruwan Jayatunge received his MD from Vinnytsia National Medical University, Ukraine in 1993 and has since built an illustrious career in mental health. He began his professional journey as a medical officer of mental health with the Ministry of Health, Sri Lanka, where he served as health focal point in Butler. A commissioned officer, the Sri Lankan Army, Dr. Jayatunge at the military hospital in Colombo provided for combatants suffering from PTSD. His pioneering on the psychosocial organized remarkable. He has worked at Barnsley College in psychosocial rehab, Humber College in Neil Fernando, training in eye movement descent reprocessing in Philadelphia, and advanced cognitive behavioral therapy training with Professor Allison, University of Ottawa. He has further on science with in addiction He has also earned certification in alcohol and opioid dependence treatment from globally renowned institutions, including the Center for Addiction and Mental Health. Dr. Tunga's prolific contributions to research and academia include publishing numerous books and articles in connection with leading experts such as Professor Somasundaram and Dr. Neil. His lectures on trauma and PTSD have been prestigious, including Harvard. He is also distinguished post-traumatic disorder, and Jayatunga continues extensive experience changes position. Uh, Today we are him share uh, Ruwan Jayatunga user. Thank you.
For that kind remark. Trust. Let me share the screen. Uh, could you make that possible? Hello, can anybody hear me?
Yes, you're audible, sir.
Okay, okay. I hope everybody can hear me.
Yes, sir, we can hear you.
Only thing is I have a little tech problem to make a slideshow. So I have to go with this level of I hope you can see the slide. Can you see the slide?
Yes, sir, it's
Yes, sir.
visible clearly.
Okay, and the slides are moving, yeah?
Yes, sir, it's moving.
Okay, great. Because the other conducted a lecture and slides were not moving, and half of after finishing the 50%, the audience told me that the slides are not moving. So great, everything is fixed. Okay, and mental well-being, and definition is based on 2003 that was published by Gorage Publishers. And what is the Oxford Dictionary defines is as a state of affair involving demand on physical or mental energy, which can disturb the normal and psychological functioning of an individual. So you can see this Copacabana or relaxing. You can see the mighty ocean. So he is very much focused to the present moment, and he is calm, and he is not overwhelmed. Whereas this guy, he is troubled by his thoughts, internal and external stresses. He's time traveling. He's going back and forth. He goes to the past, he goes to the future. So his head is like Willy Wonka's chocolate factory. So is a state of tension that is created when a person responds to demands and pressures that come from work, family, and other external sources. Also, stress can come from internal, from your inner thoughts. So here we clearly see can generate also from inside. So, what is mental well-being? We all try for mental well-being. In general, it's a state of thriving in various areas of life, such as in relationships, at work, play, and more, despite ups and downs. So, every day we face ups and downs. We cannot have a perfect mental well-being because outer environment is chaotic, and also internally you are battling your own demons. So we always have a sort of a roller coaster type of mental state. Despite the fact that we always want to have a normal physiological and psychological functioning, and it's an innate purpose in our lives, and also we are geared to drive towards that. So various make meditations, no Maslow. It's eventually that we want a stress-free life with cause it can cause harm to our internal systems, and these stresses come from our family, work, home, everywhere. And as academic work, so you name it, we have work related issues, family issues, and everything. So this is kids deal with and there was no and uh, the children uh, games, and this was the of dealing with stress. So definition of stress. its original objective, it fixes upon an alternative. So these impulses leads to sublimation, and it can also lead to in basic worry, that is situation. It's a very natural thing. Being stressed is you are a human and you are alive. It's a natural human response, and it comes from our basic biological systems. And we have to understand that there's a birth trauma the moment that you're born, because most of us, we don't remember. It's a very, very traumatic thing, because the child is inside the mother's womb in a water-based environment. All of a sudden, your environment is being changed, and now you are forced to breathe air, and your lungs has to be functional. So it's a sort of a highly stressful moment for the infant. And even in utero, the embryo is experiencing stresses. And this was research proven facts. I think in Helsinki, they did some research and they found where the maternal stress highly affects the embryo. So if the mother is under severe stress, these maternal stress hormones can affect the embryos, its growth, and also its psychological well-being. And the child inside the mother's womb, the he can feel the depression and anxiety, and it affects the neurobehavioral development of the fetus. So stress is not 100% bad, because if not for stress, we are, even today we are living in caves, because millions, like we started our journey in African savannas, and 20,000 years ago we were hunter gatherers. We evolved. We came from the jungle, and we opened new avenues, we opened new doors. We now we conquered the space, and it's we came to the atomic age, we came to uh, the, the new technologies, and now we are walking towards AI. This is because of the stresses, because we wanted to evade from stresses, and the stress factors actually motivated us to run away from our primitive lifestyle. A lot of people say that I need a stress-free life. I mean, but indeed, we all can get a stress-free life. Yeah, you always face stresses. You have to encounter stresses, and there is no way of evading stress factors in our lives. So, what are the major types of stresses? The frustration, because we always face failures, exam failures lives, it can cause frustration. And when you have more uh, motivations, like for your uh, boyfriend or girlfriend invite you for his or her birthday, but your friends want to have a different party. They are going on a trip, and you don't know what to select, whether to go with your friends or whether to be with your partner. And either way, it's very difficult to select. But you don't want to sort of partner or friends, and you are in a sort of situation, and it generates stress. Sometimes life changes are stressful event. You can recall the very first day you were city after your it's a life change. Let's say after finishing your education, all of a sudden you have to go to Australia or to England or to further your education. Uh, Kate, so these or you are getting married, or you change your job. It's also can cause a lot of readjustment problems. And pressure, I don't need to mention about pressure, because you know that with the assignments, you guys are always pressurized. So when the work related demands, and it's we have time demands and expectations, so it can cause a lot of pressure. So being a good servant and a balanced life, it's a silent killer. Actually, it's not the stress that kills us, it's our response to the stress. So uncontrolled stress can ruin a person completely. It can damage his vital organs, immune system, psychological system, biological system, social systems. You know that the person has different dimensions. That his biological dimension, his social dimension, his economic dimension, etc. So the socio-economic development go hand in hand. I want to tell you a story. This is about one of our ancestors. So, like thousands of years ago, we were hunter gatherers, and our great grandfather was a perfect warrior. So there were two great warriors, Hunter A and Hunter B. So Hunter A was a perfect warrior. He was fearless. So he was hunting animal and bringing food to his group. So as the Hunter B. But Hunter B is not a risk taker. Sometimes he gets overwhelmed when there's a risky situation. He's sort of petrified. So he tries sort of not to perform like the Hunter A. So one day they go for hunting, and they see a lion. So being a perfect warrior, Hunter A goes and attack the lion, and he gets killed. But whereas Hunter B, he was petrified, and he runs away. So we are the descendants of Hunter B. So we carry his anxiety, we carry his stresses, we carry all his fears and all the demons in our heads are thanks to him, Hunter B. So that's a short story about how stress and evolution worked. So we mentioned about the routine stresses. Now, every day you have to wake up, you have to come to the university, you have to come to your workplace. Even though nowadays we are working from home, we have stress factors, like you have to finish your home front things, then get ready to fulfill your other work related obligations and responsibilities. So these are routine stresses. When you hit the street, see the traffic, and also like all of a sudden a three-wheel guy gives you a finger. So I mean, it makes you really upset. So these are the small t traumas, as Dr. Francine Shapiro, the creator of EMDR, what she mentions. Every day we encounter small t traumas, or like routine stresses. Sometimes we have relationship issues with our partners, spouses, the parents, in-laws, with children. Sometimes we argue. We For minor matters, sometimes we get upset. So those are routine stresses we face. Even with your co-workers, you have a sort of couple of words, and it causes you certain negativity. But there are sudden disruptive changes in your life, like losing a job. All of a sudden there's an economic crisis, or like let's say some natural disaster has damaged your house a major portion. So it's a sudden disruptive change in your life, and it can cause a sort of an acute stress. And there are traumatic stresses that due to man-made disasters, sometimes natural disasters, severe accidents, death of a family member, environmental disaster, or war trauma. So we know that we experienced 30-year war, that we're going to talk about it later. And these are the traumatic stresses, like racial violence. and tsunami disaster, 30-year war. There are stresses and distresses and eustress. Eustress is sort of like a positive thing. It's a happy moment. It's a positive stress, but also it generates certain, it affects your homeostasis. Let's say you get a promotion and you are happy, but in the meantime, now you have other responsibilities, other obligations, and let's say all of a sudden you get a green card and you have to go to the States. So you are happy that you are moving to the United States, but now that eustress with that eustress, other types of issues are coming. Now you have to leave your family members sometimes. You have to leave your job and you have to go there, and now you have more prospects, more hopes, and also there are sort of changes in the destiny. So eustresses affect us, even though they are positive. So the difference between distress and eustress is our perception. So it could be negative threat, whereas eustress is a positive challenge. And the emotion distress brings anxiety, and eustress brings excitement. And procrastination. Yeah, we all are procrastinators. Like we postpone things, we try not to engage. That's also following stress. And in eustress, we are motivated. Sometimes we have like false optimism. We are over enthusiastic. So the distress can affect our performance, same as the eustress. So these are the common major life events that can trigger stresses, including job issues, even retirement. I have seen a person, in fact, I treated several people after their retirement. They feel that, now they lost their purpose, they lost their respect in lives, because they used to command a lot of people. Especially this happens with the military people. They have a difficulty readjustment to their civil life after the retirement. So they feel stressed. Sometimes lack of money or lack of time can cause stresses. Bereavement, any death of a family, any sort of sad event in your life, and relationship problems, family problems, any type of illness. Let's say stress, and you relocate, and relationship issues, may mention marriage, divorce, separation. This all can cause stresses. And when stress hits you, stress hormones come into action, especially adrenaline, norepinephrine, cortisol. These stress hormones are not 100% bad. We need these stress hormones in order to function. But what happens is, when stress is overwhelmed, these stress hormones can decay your internal organs, starting from your skin to your eye, everything. Like it can brings you headaches. Probably you have seen a lot of people with tension headaches, and even time to time when you are under stress, you are getting tension headaches, migraine attacks, heart diseases, hair loss, sexual dysfunctions, weight gain, weight loss. Sometimes under stress, people start eating. I remember once I treated a patient, he had eating disorder. What he said, when I'm eating, I feel stress free because food doesn't judge me. So when people are under stress, either they have eating disorders, either they overeat, and they skip their meals. Top of that, they get gastritis. So this Red Army soldier, within 4 years, what happened to him following the stress? You see a very young, vibrant guy, all of a sudden, due to stress hormones, stress factors, see his face, his eyes, his skin texture. So rapid aging, stress can cause rapid aging. There are a number of emotional reactions to stress, including anger, burnout, concentration issues, fatigue, feelings of insecurity, forgetfulness, irritability, restlessness. Anger is a common reaction. People get irritated. They sometimes they have unstable emotions. They go into sort of rage. You have seen road rage. When work-related stresses affect the person, he goes into burnout. Because yesterday I did a work-related session. So there we spoke about stress and concentration issues. He's unable to concentrate. We see it in a lot of school children, especially those who are doing O levels and A levels. Under exam stress, they find it difficulty to concentrate. Sometimes following stress, you feel fatigue, like you are overwhelmed, exhausted, your energy has drained, and they have a feeling of insecurity. They don't have they don't see a clear tomorrow. There's no light at the end of the tunnel. And the forgetfulness, they tend to forget things. And especially with exam stress, you study everything. When you go to the exam, you go blank, you don't remember anything. And irritability, also another factor. Sometimes people become passive aggressive due to stress factors. And restlessness, they can't relax. Even though they go to sleep, they sleep for 5 6 hours, but they wake up and still they feel fatigue because it's lack of REM sleep, rapid eye movement sleep, following stresses. So, physical symptoms of stresses include aches and pains. People can get joint pains, back aches, headaches, chest pain, like you are getting a heart attack. I remember soon after finishing my internship, we were posted to the OPD at the Matali Hospital. One day, a patient came with a heart, like a severe heart pain. It's masquerading as a heart attack. And at that time, we didn't know about these psychological ailments or the stress factors. So everything was a sort of a medical thing for us. And then the ECG was done. ECG, there were no ECG changes, but yet he wasn't treated for myocardial infarction. But what did I conclude? Now I can come do a sort of psychological uh, conclusion. So this person had he was a teacher and he was under a lot of stress, and he was thinking about his stress factors. All of a sudden, he got a chest pain, and this is a sort of fake MI, but it was stress related pain. And they have troubles sleeping. Some have nightmares. Some can't. Some unable to sleep. The whole night they are awake, and dizziness, shaking, and stress can affect blood pressure. Your blood pressure goes up, and muscle tensions, digestive problems, gastritis, and trouble with libido, with reproductive health, and they become very susceptible to any infection, and they have weak immune system following stresses. So these are the cognitive problems. We mentioned memory problems, inability to concentrate, their judgment obscures, because when they are under stress, they can't come to a proper conclusion, because everything is masqueraded. Everything is uh, covered. Their inside is covered, and they go into poor judgments, and they see only the negative things. Even happy things, positive thing happens in their lives, they interpret as a negative thing. And they have automatic anxious or raising thoughts, one thought after another, one stress thought after another. They reproduce, and all everything is connected with negativity, and they constantly worry. I had a patient. He had OCD type of anxiety disorder, and also high stress. Every day he wakes up, he thinks that the our planet is going to get hit by an asteroid. It's an irrational fear. I mean, it's a one in million chances, but still his worry was that it's a OCD type of negative rumination. But that was highly stressful for him. Every morning he wakes up, he's thinking that, okay, now the asteroid is going to hit the planet. And he was rational. It was not a psychosis. So stress can affect sometimes people have irrational fears. And following stress, they can experience depression, a general unhappiness, because depression and stress, it goes hand in hand. High stress can cause depression, then anxiety and agitation, irritability, anger, feeling overwhelmed, and following stress can lead to loneliness, isolation. Alienation is one factor in our society because of stresses and mental and emotional health problems. So burnout is a syndrome, chronic work. It's resulting from chronic workplace stresses, and the person feels that his energy is drained. He can't work anymore, and he has no energy. He's unable to concentrate. Going to work is a nightmare for him. So burnout is a very a common thing. It happens with the workers, even with students. University, I have seen university students because following high. He said that uh, uh, a bunch of stress producing thoughts, and also it gives rise to another bunch of stress producing thoughts. So it's a sort of a endless reproduction inside your head. It has negative automatic thoughts, and people make uh, wrong assumptions, and they have negative beliefs. Sometimes they have a small uh, argument, or small, he get a reprimand from the boss, so now he goes into this negative loop, and he thinks that, okay, now everything is gonna end, now he's going to fire me, now I have I'm going to lose my job, and I'm going to lose my mortgage now. How I'm going to face my family, we are going to face a lot of problems in the near future now. So minor matter, now he's overthinking. So common internal causes of stress include pessimism. Some people are, they have it's following their childhood upbringing, life philosophy, childhood trauma, and the environment they live. Sometimes due to cultural factors, they have pessimism. They are always pessimistic. They always see the negative side. And some people, they have inability to accept uncertainty. When there's something uncertain, they are under tension. And in North America, if they say that there is a snowstorm, sometimes, because I lived in Ukraine, I lived in Russia, and I have seen real snowstorms. So in North American snowstorms, it's minor matter. It's like minus 25, minus 15, sometimes a little wind. But but people get overwhelmed because they can't accept uncertainty. They start buying food stuff. They're buying salt like crazy, and it's causing sometimes these corporates, they misuse these uncertainties. Sometimes the media creates an uncertainty to in order to sort of either they want to gain something, financial gains, social gains, political gains. So you cause certain uncertainty, and some people can't accept that. And some people, they have rigid thinking. They lack flexibility. It's my way or highway. Like there has to be like that. Otherwise, they get overwhelmed. So everything should be in certain order, and they can't deviate from the routine, and that lack of flexibility, it can cause a lot of stresses in their lives, and always negative self-talk, and you demean. This is following chronic depression, low self-esteem, and they always have negative self-talk. They demean themselves. They always think the the negative side of them. They try to emphasize, they try to highlight the negative side. And some people have unrealistic expectations. They are perfectionists. They want like uh, if sometimes the parents have these unrealistic expectations of their children, like you have to get the either 100%, you have to make it 100%, you have to always be the first. Anything lower than that they can't accept. So they are giving unrealistic and high demands for children and for themselves. All, and also a black and white thinking, all or nothing attitude. So these life philosophies also generate internal stresses. And people go into negative stress coping methods when the stress is overwhelmed. They find different avenues. Sometimes these negative stress coping methods are very, very harmful to the system. And these negative stress coping methods can create high stress. What are the negative stress coping methods? Like drinking alcohol too much, drinking every day, sometimes drinking alone, drinking large amount of alcohol, and they drink until they pass out, and to forget the problem, forget the stress factor. Some go into severe gambling. I have seen professional gamblers in Las Vegas and in the Atlantic City. So 24/7 they are there, and engage in gambling, expect to win. So gambling is actually, it's not very much visible in our society, but in the Western societies, gambling has become a problem. Like they do, even in online gambling, they engage in online gambling. So we mentioned about overeating or developing an eating disorder. And sometimes the sex addiction is one of the negative stress coping methods. In the Vietnam literature, you find some of the officers following combat stress, they have developed deviant sexual behaviors. In our studies, which we did with Dr. Neil Fernando, we found some soldiers following combat stress, their libido has been changed, and some people engage in deviant sexual activities. So this is not the problem. This is not the personal issue. It's not the moral degradation. It's all about this the negative stress coping methods. And some and some do drugs, crystal meth, ecstasy, you name it. And in each culture, they have we're going to have a separate discussion, because some clinicians highlight the therapeutic importance of cannabis. But in my practice, I have seen a lot of young people using cannabis for recreation, as a recreational drug, as negative stress coping methods. They end up in psychosis and depression, or cannabis amotivation syndrome. So that's one thing I want to tell here for today. And also, following stress, people transform. So they are stressors. Stress transformation. So I want to ask a question: who killed the cat? Okay, you guys don't know. Let me tell the story. So there was a worker. He's a very decent worker. So one day he gets a reprimand from his boss. So this guy, obviously, there's an immense power disbalance, power dynamics at workplace. He can't say any word to the boss. He had to keep his head down and listen to the blast. So he made a blunder, and he got blackguarded from his boss. So that ruined his day. So now he's worried, he's highly stressed, he's having negative uh, thoughts. Now he goes into loop, thinking over and over again. So I've been working, I've been working hard, but this guy yelled at me, and he's upset. So then he comes home. His wife is but now he's under tension to dump his garbage. So the best thing he so now the guy uh, how he gets it a cup of and he's shouting at his wife. Now he's transforming his stress to his wife. So the wife is now upset. The whole day she was okay. She was cooking and washing and doing all the domestic stuff. All of a sudden, this guy, the husband, came and yelled at her. So this is a very traditional housewife. She doesn't talk back. Okay, so that's our assumption. And she keeps her head down and takes the blow. So now the wife is upset. Then she goes to the kitchen and she hears a sound. Their uh, teenage son is playing video games. He's playing, I don't know, whatever the video games, GTA, Grand Theft Auto, or Call of Duty, or whatever the video games. Then she gets angry. So she goes to his room and start yelling at him, saying that you are not studying all most of the time you are playing video games. What are you going to do? You are going to fail your exam, and this and that, shouting, yelling at him. Now the kid is very upset. The kid is like he was having a good time playing these video games, and all of a sudden this woman and shouts at him. He said, "What the wrong with this woman?" He gets angry. And they have a beautiful dog, nice dog, German Shepherd. So out of anger, he kicks the dog. Now the dog is upset. Why? I mean, what happened? This guy, he kicked me. So now the dog is angry. Dog goes out and sees a cat, and the dog kills the cat. So you can see the stress transformation, how it came tumbling to different people. So we said depression cause a lot of anxiety, post-traumatic stress disorder, and even diabetes. And most of these ailments, even cancer, the basic etiology is stress. And socially, it can cause low productivity, stress-related illnesses, and stress can change our brains. This is research proven fact, like especially in severe anxiety disorders, especially in complex PTSD, aka CPTSD. There are changes in their hippocampal region, their amygdala. So stress hormones can attack the brain structure, brain morphology. So stress is not sort of a psychosocial thing. It's not only a psychological problem. It's not only a social problem. It's a biological problem too. And kidneys affect the stresses can affect the kidney. When once the kidney is being affected, it can cause the story with a face by the body. They become rapid aging. Red Army soldier. And stress can cause reproductive health. Uh, chip issues and can trigger he started having first the then and that somebody is transmitting video signals to his head. Those who have vulnerable in their when they face stresses, it can give rise to schizophrenia, bipolar affective disorder, acute transient psychotic disorders. Stress and suicides go hand in hand, and sometimes following stress, people commit suicide, like they end their lives. And every year we see after A levels, some the kids they commit suicide. Sometimes university students, medical college students, they suicide. Especially suicide rate among the anesthetists are high. One time I did anesthesia one time, and when I heard this, I changed my field to psychology, and that's a joke. So, but we cannot deny that there are high suicide rates among the professionals, and stress and homicides are also there. And in the armed forces, you find people the bad man management, overwhelmed stress, the person goes angry and he kills his co-workers. And these things are very, very happening in our system, in other countries. So I would like to say a few words because for people, ragging uh, is a highly stressful. Following ragging, they can develop depression, acute psychotic disorders, and so the the students and the education system uh, these factors. So can we measure the stress? Stress is a very subjective field. Uh, 1976, Thomas Holmes and they introduced the Holmes Rahi scale. So this based on the Western culture, like death of first needs, divorce 7 units, marital separation 6, work 40, the boss 23 units. In our part of because of our cultural, uh, this could be so. Being said that, I would like to highlight that sometimes culture can stresses. A lot of people migrate these days. They go to Australia, they go to United States, they go to Canada, to England, Australia, and these families when they relocate, so they go with their home culture, their domestic culture, their native culture. So they have difficulty adapting to the new culture in the Western world. So that causes a lot of stresses and a lot of families, because sometimes the children now they get used to the culture in the Western country, and the parents sometimes they become overwhelmed. So we discuss about number of stresses, but environmental stresses we have to talk about. And we know that excessive rain, sometimes drought, anything can causes large mass stresses. And the combat stress we spoke, following the 30-year war in Sri Lanka, there are a lot of combatants, even civilians, and the, the the members of the LTT child soldiers, still they carry the scars of the war. So there are undiagnosed, untreated post-traumatic stress disorder in our society. So experts think seriously about this fact, because we tend to think that war is over, everything is finished. These post-war issues following at the end of the war, 2009 and 2000. I think 15 or 16. I'm not quite sure about it, but this is after the war. 400 soldiers committed suicide. So there was no war. Why this happened? So we have to ask. So there was no battle stress. There was no life-threatening situation. But soldiers, they lived. Some of them suffered from combat trauma, and they had other issues. So we have to seriously think about that. Another factor is exam stress. An education system, starting from the kindergarten, we impose a lot of stresses on students. Nearly 30% of Sri Lankan have learning difficulties following stress. This is not my interpretation. This was said to me by Dr. Tiloka Sundari Karyavasam, the one of the prominent educational psychologists in Sri Lanka. And during exams, children, they this year 5 scholarship exam, and children go into psychosomatic ailments. They go into they are getting headaches. They have various types of sometimes they have psychological and physiological ailments. Some have dissociation, some have epileptic type of fits following exam stress. This book I wrote somewhere in 2005. It highlights about the learning difficulties and what are the treatment measures we have to take. In Sri Lankan education system, we know that we use physical punishments and we use humiliation, and we don't listen to the child. And most of the schools, they have school counselors, but most of them are not properly trained. They don't have basic child psychology and understanding of child psychology. And it's sometimes these children, they are overwhelmed, and some commit suicide. And recently there were 3 suicides reported, teenage suicide. That's a very, very sad story. So we discussed about work related stresses due to long hours, office politics, lack of job security, lack of acknowledgement, unfairness, and also micromanagement. Those things can cause a lot of work related stresses. What is Siberian syndrome? Nobody knows. I will tell you. You don't find this Siberian syndrome in medical dictionaries. So Siberian syndrome happens to SLS officers, these Sri Lanka Administrative Services. When a government changes, uh, a set of these secretaries, additional secretaries, they being sent to a undesignated areas, what you call that Sanchita, and they don't have work. They don't have any specific work. They come in the morning, they sign, and evening you sign and you can go home. So you in a way it's nice. I mean, you don't have any responsibility, you don't need to do any work. So until you get a position, you are there, you are in limbo. But this causes high stress for a lot of SLAs officers, because these administrators, they command respect, and there are a lot of people under them. So when they were in their respective, they were like kings. Now you are in a sort of some God-forsaken office. Nobody knows you, nobody recognizes you. You are there, even though you don't have to do any work. A lot of these officers experience stresses. They sometimes they develop heart attacks. Sometimes they develop diabetes. But a small fraction of these officers are very, very smart. I know of one officer when he was Siberia, called so-called the Sanchitaya. He started doing his external law degree, and for several years under this punishment transfer. End of the punishment transfer, he obtained a law degree. So smart guy. So this is how he faced the stresses in a positive way. Sometimes personal stresses can cause relationship problems, relationship breakups. So how many young people commit suicide? Sometimes they go into self-harm following personal stresses, these relationship issues. And remember, socio-economic stresses we face, and let's say when there's no electricity, when there's no petroleum, the masses, it affects, it causes sort of a mass stress, social stress factors, and family stresses following the poverty, economic issues also can cause stresses. And cultural stresses, as I told you, like when people relocate, they have these the difficult, these cultural lagging, sometimes culture clashes, uh, because each culture and each religion, you have sets of values. Sometimes these values being compromised when you are living in another country. So people view this as differently. I know some families, they couldn't cope up when they go to Western countries, and they came back. So these cultural stresses are enormous. The cultural stresses, people face it because in uh, uh, the cultural settings, sometimes we don't understand, and they always live in the Western country, their own pocket, our own pocket, and Sundays they meet with these people. They don't mix up with the major cultures, up with the uh, so on and cultural, and these cultures are very, very uh, on that. It and political stress. A lot of countries now see what's happening straight, and then some political decision, the entire population suffer. It's causing collective trauma, and this is very, very frequent. Institutions, they do silence the, they don't understand, and spiritual value, these mega dominate with their religion, and they don't understand. These people don't realize that not can affect people, causes stress. It can their sleeping pattern. So the and the health sector has uh, uh, some of the religious like 24, sometimes the people are troubled unwanted. So we'll see that stress. What are to reduce stress? Because it's important, because stresses are unavoidable. Every day we have to face stress factors. Take a walk every 30 minutes walk. When you walk, you see different people, different environmental settings, trees, greenery, and it brings you to the present moment. And also the lactic acid in your system, in your muscles, also diminishes when you start walking. So meditation is important. When I say meditation here, I don't want to highlight any religious or cultural meditation, but professional breath meditation, and breathing, which is very, very important. You are giving a lot of oxygen to your brain. Your brain is craving for oxygen because if you cut oxygen to your brain for 5 to 7 minutes, the brain dies. And brain is highly sensitive for oxygen. And you give more oxygen to your brain, you can cut down a lot of stresses and focus to the present moment at least 10 a day. These mind being mindfulness, even working mindfully without time traveling. If you have work related stress, focus to your work. If you have exam stress, uh, focus to your schedule. And sometimes people muscle relaxation, gyms, yoga, visualizations. uh, your room and you have no, you can close your eyes, you can visualize the ocean, you can visualize green forest. Those visualization also helps to reduce stress. And deep breathing, as I mentioned, deep breathing, mindful breathing is a very good stress breaker. So positive stress coping action, turning stress into a challenge. When we our internship training, and a lot of people were uh, you come to 1 year internship 24/7, you don't have leave, you had to be in the hospital 24/7, and you have on calls, daytime, nighttime. You sleep 2 3 hours a day, and there are no regular meals, so it's like a sort of very, very tough training. So a lot of us, we were overwhelmed by that. We were sort of, we frightened. We didn't know that whether we could successfully complete our internships. So there was a senior doctor, I remember, he said, think it, challenge that. Think that this is like a commando training, and 1 year you are going to get this training, and after that you'll be fully fledged doctors. So turning stress into a challenge, especially in combat stress, stress inoculation, they turn stress into a challenge. Also making a threatening situation less threatening. The stress uh, too high, it's enough. Sometimes you can take reduce the threatening threatening. Also goals, like sometimes we have expectations and we know that the defeat is imminent. It's okay, I would settle for, we can't every time, we can't be winners, sometimes we fail, like accept that. It's okay, it's okay to be a loser once in a way. And also taking a physical, mention about going exercise, mindful breathing, and other that we're going to discuss in a while. Preparing for stress before it happens. You have uh, you have a very stressful within 2 months time. If you know that you have to fulfill this because you are working, prepare this report, and it's going to be very tough. And you had to face this interview. You had to face this, whatever the legal issue. You prepare for that. So prepare before it happens. And relaxation training, we said, you can listen to music sometimes, socializing, going with your friends, going for a movie, the meditation we mentioned, and physical exercise, aerobics, and the balanced diet is very important. I remember one time, soon after tsunami, this occurred. There were children, a number of children showed ADHD type of behavior. Then some of the doctors, they thought that ADHD, but when they referred to us, we treated these children with vitamin B for 12 weeks, and drastic change in them. They are diminished. So balanced diet is important. Most of us, we are not getting a balanced diet because we have dietary restrictions, sometimes religious imposed, social imposed, or culturally imposed. And we mentioned about imagery exercises. Imagine that you are in a very nice, you are experiencing a very beautiful scenery, and sound therapy, music, baroque music, Mozart, symphonies. Sometimes we used to treat soldiers with PTSD with sound therapy, with nice music, and they fall asleep. These people had insomnia, chronic insomnia, but following sound therapy, music therapy, they were able to gain a good sleep. And adapting a humor, that's a very nice way, because sometimes you can't uh, change the drastic stressful events, but make it humorous. Like always, humor is the best medicine. Humor is like grief. It's contagious. And try to see the funny aspect of even a disaster. You can see the funny aspect of that. Sleep is very important because we don't sleep appropriate hours. We ought to have 7 to 8 hour good sleep. If you skip your sleep, it gonna problems. So we mentioned about physical exercises, walking, going to a gym, balanced diet, and the meditation is very important. And there are about various types of meditation. So this meditation I wrote, and it discusses meditation can be used in psychological ailments, cultural or religious. Humor is a very, very, sometimes even when a disaster, don't forget your sense of humor. Sometimes stress with our negative life philosophy. So we have to challenge. We have to internally have a dialogue with ourselves to change our negative. Sometimes irrational sets of, we think it has to be like that. Now I lost this position. I I lost this reputation. Now I'm, but you can see some poor people have anything, but they are happy. Something with your life philosophy. Always, you can be, because yesterday in my lecture, I told, I have spoken to Gulag prisoners, former Gulag prisoners in the Soviet Union, and Holocaust survivors, and also POWs, prisoners of war. Even they were living in their deplorable situation. They told me that there were events of happiness, there was events of content. So despite the severe stresses you face, there are vacuums, there are happy vacuums inside you. So don't lose your hope. And boundaries are very, very important, because as families, with our in-laws, with our parents, with our children, with our neighbors, with our colleagues. We have this problem maintaining healthy boundaries. Sometimes, the neighbors, they encroach, and if you open your uh, boundaries and you don't have proper demarcations, of course it happens. Everybody tries to barge into your life. So maintain healthy boundaries. Otherwise, what happens is your life is becoming full of problems. Sometimes married couples face that unwanted interferences from their relatives because they don't maintain healthy boundaries. And maintaining healthy boundaries are very, very important, even at workplace, with your bosses, with your co-workers, with your subordinates. You have to maintain certain healthy boundaries. See this guy, the outer world is ablazing. There is war is going on. It's crazy. It's death and destruction. And he is listening to Mozart. And the this picture gives a lot of reflection. Whatever the chaos, you can't change it. You can't correct the world, but you can correct whatever inside you. So he's is going to happen will happen. I'm not going to lose my. So you always happiness. So stress management can help challenging this, altering how a person. That's your sometimes stress factor that you so-called stress factor you assume is not at all. It's maybe your assumption. It's maybe assumption. Maybe internally generated uh, demons. Maybe whatever the change is going to happen, it's good. But you perceive uh, it's nothing to off or nothing to be stressed off. You can face it. And lowering the effect stress might have on the body. So biologically prepare for the stress. You have a good sleep, taking measures against stress factors, and learning ways of coping. Sometimes the box. If you read books, if you lectures, they have the map set of uh, stress management methods, but you have your innate way of coping. Like some people, they write songs, they write poetry. So if you are creative, do whatever the creative things to what brings you happiness, what brings you moment. And stress is important. Write about in a sort of highly stressful situation, no escape, surrounded by demons. Write, write about. Keep it confidential. Write about your thoughts. Write about your emotions. Write about whatever the injustices happening to you, and document it. Remember Anne Frank, because of war, she was trapped, and they were hiding in a small room with her family and some of their family friends. So, in order to maintain her sanity, she maintained a diary about her thoughts, her day-to-day feelings. So, I think these helped her immensely to deal with her stresses. And art therapy is important. We used to do art therapy with soldiers who supposed to combat trauma, not articulate ways of telling their traumatic. Art therapy, it's a very good stress breaker. Even and this child, his uh, uh, operate in operation. So he faced emotional deprivation, that anxiety. So he didn't have work, eight, his anxiety, negative thoughts. A big fish is his father. that he depicts form. And totally, he wrote a very, very great book. It highlights about the being in the moment, the power of when you are in the present moment. No stress, no anxiety, no depression or negativity can hound you. You are, because you are in a protect, you try to move away, you go to try to time travel, take your thoughts to the past. That's, you are sinking in the future, you are anxiety. So if you focus, train your mind to be present moment, it's very, very, because these ailments can't get you. You are protected. So before winding up, I just want to talk about the main points. So physical activity, relaxation, breathing, yoga, maintaining humor, uh, making your social connections, find good from toxic relationships, toxic. If people are demeaning you, if they don't see your back, you don't need to stress your life. And start hobbies like uh, horticulture, stamps, or reading books. So there are social things that you can manage your stresses. And self-care is very important. Our loved one, as a parent, as a father, do a lot to your loved, forget to take self-care. Really, uh, for that. So that the self, you have to take self-care. Our culture, we think that it's okay. You give everything, you possessions, your physical health members, and even you drain your energy. Self-care, it's very, very important. Other professional techniques go in depth, like bio incident stress debriefing, EMDR. It's a bilateral stimulation, right brain hemispheres, and negative memory for post-traumatic severe anxiety and therapeutic relaxation, psychological counsel, because people, when they are stresses, they have a lot to say and there are no empathetic listeners. And counseling helps a lot, especially in university setups, in school setups, and in the professional environment. So meditation, being mindful. Remember, stress is not what happens to us, it's our response to what happens. Response is something we can choose. Either we can go into negativity, or we can make it, sometimes we can challenge the stresses and we can create something out of that, because always we can convert this negative energy into something positive. So always try to do that. And the one final message: so nothing is permanent in this world, not even stress. If you think that your life sucks and you are sort of sinking in stresses, don't worry. It's a very temporary reaction, it's not permanent. Okay, ladies and gentlemen, thank you very much giving me this opportunity. So I must thank Dr. Ransirini for giving this opportunity. Thank you, madam. And it's an honor and a privilege to address your students. And thank you for organizing this. So if you have any questions, I'm ready for that. Shall I stop sharing my screen, or you want me to keep it?
Sir, I have one question.
Could you please?
Yes, sir, I'm who's studying for the first program at the OUSL.
Go ahead.
Yes. Are there any to assess stress related to work or relation matters? That is my first question. Is what that we, extensive expect if in a stressful fight, sir?
Yeah. There are sometimes big anxiety. There are parameters we can use. There are certain questionnaires are very widely accepted, especially some based on your workplace. We can formulate that sort of questionnaires to identify stress factors, to measure stress. There are standard questionnaires are there, and when I when uh, when I was I 20 questions for the recruits to identify their stress factors. So you can always formulate the relevant stress what are the imminent stress factors, and what are the things that we have to take precautionary measures. So it's possible. It's possible, and sometimes those are very unique, and it's not very universal. It's not applicable to each and every setup. For instance, if you really want to create one for the university students, yes, we can do that. We can do that. We can identify their prior stresses. We can identify what's happening in their home fronts, what's happening there in academic career, and how things are going with their friends at the university, their uh, other friends, and with the studies, with the teachers, etc. So definitely we can formulate that sort of methods. The second question is, and when a person is highly stressed, there are a number of symptoms, especially if a very sociable person. Sometimes he goes into isolation, and sometimes they stop associating friends. Some people talk about self-harm. Some people talk about quitting their jobs, quitting the academic career, leaving uh, homes, and they some face a lot of psychosomatic. Some have psychosomatic ailments like long-term headaches, muscle pains, exhaustion, unable to sleep. Basically, they are unhappy, they are overwhelmed. Sometimes it comes as a behavior sign. They become isolated, alienation. Some become aggressive, some become very combative, some are sort of some become even violent. So stress factors can change the person's behavior, his personality, his perception, everything. So here we are not talking about the minor stresses, day-to-day stresses. We are talking about the high stresses. So definitely we can identify the underlying stress factors, uh, and most of the time people nowadays, people are very very they they have a lot of insights. So they've said that, I think I'm highly stressed, I cannot work anymore, I feel that I'm overwhelmed, I'm drained, so I need some help. So that's a good sign. Unlike those days, like talking to a counselor, going to a psychiatric appointment, there's a sort of stigma is associated. Still, the stigma factor is there, but I think it's less now. More and more people are becoming professional counselors, and people seek help. So we have to understand that there's a difference between psychological counseling and the psychiatric services, the medical practices, and even the doctors are getting training in counseling. So the support services are there. I think now a lot of people, they reach these services, which is a good sign.
So thank you very much for your in detail answers, sir. Thank you.
Oh, you are most welcome. Any other questions, please? You can find my email at the department. If you have any questions, please feel free to email me. I'm happy to answer your questions. Oh, there are 27 messages. Oh, yeah. Someone is asking, can you share your books? Yes, I have of my. So I will send to the department, and I will email it to the department. You can get the PDF version. Some of my books, I have the PDF versions in English and Sinhala books. I'm happy to share knowledge and some of the research papers that I have written.
Good afternoon, everyone. As we bring this session to a close, it is my privilege to share a few thoughts and convey our heartfelt gratitude to those who made today's session a success. First and foremost, I extend our sincere thanks to our distinguished speaker, Dr. Ruwan M. Jayatunge, for sharing his profound expertise and insights on stress management session. We truly appreciate the time and effort you have dedicated to helping our students understand the importance of mental well-being. Thank you for making today's session so impactful. So we are deeply grateful for our Vice Chancellor Professor PMZ Tilakaratna for his leadership and continued support in fostering opportunities for growth and learning. Our special thanks to the Dean of the Faculty, Professor BSS De Silva, for his unwavering encouragement. I would like Chair of the Learning Faculty of Health, D. her the planning and execution of this session. Also, a big thank you to the staff of Department of Psychology and Counseling, who hard work behind the scene ensured everything runs smoothly today. Especially, I like mention Miss Faika helping with today's event. To all the participants, thank you for your active engagement, thoughtful contributions, and enthusiasm throughout the session. So finally, warm thank you to everyone else who contributed in your unique way to the success of. So in your all endeavors. Thank you very much.
Thank you very much, and it's a great opportunity you gave. I thank you for the vice chancellor, the dean, and the university administration, including Dr. Ransirini De Silva, for organizing this, and FICA for doing the coordination work. Thank you so much, and I'm so happy to be here, and I'm very happy to address this gathering. So, indeed, I will send the PDF version of my books. FICA, kindly send you an email. I will email you my books. So please
Thank
the students. Thank you very much.
Thank you, sir. Thank you very much.
Thank you, sir.
Thank you, sir.